A lot of people coming in now. All right, so let's go to the next slide, please. All right, welcome everyone to the official Strategies Technical Assistance launch. We're really excited for you all to get to know the new Strategies Technical Assistance, or Strategies TA as we call it. Let's move to the next slide, please. Before we do that, we just want to let you know that this is brought to you by a collaboration between the Child Abuse Prevention Center, the Children's Bureau of Southern California, and of course, the Office of Child Abuse Prevention. Next slide, please. Before we start, I just wanted to bring your attention to a few important things. And if you've used Zoom before, you're probably really familiar with a lot of these functions, but if you're not, I will go over those. Everyone right now is muted and cameras are off, and we will unmute folks later on today because we will be having a breakout session and some other discussions. The chat function is where you will communicate with us and others, so you'll be able to use the chat function. If you have any questions, please, if you're having any difficulties seeing or hearing something, please chat with me and we will be able to help you out, or anyone else who has the Strategies TA logo in their background. You can also raise your hand or give a thumbs up down in the reactions, which is on the right-hand side of your control panel. Next slide, please. And so now I'll go ahead and leave this, pass this over, I should say, to Hillary Conrad from OCAP.
I think briefly before, yes, no worries. I'd like to introduce myself as well as my colleague, Michael Williams. Hi, everyone. Good afternoon. My name is Sarah Lacroix, and I am the co-director for Strategies Technical Assistance with Children's Bureau of Southern California for both the Central Valley and also Southern California regions. And Michael?
Yeah, thanks, Sarah. I am Michael Williams. I am the other co-director with the Child Abuse Prevention Center in Sacramento, and we cover everything north of what Sarah and her team does. So kind of the northern San Joaquin Valley and Sierra and coast, Central Coast on up.
I apologize. I was very excited to just get things going. Also quickly, I just want to bring our attention to that we will be sharing a link in the chat for a Google Doc that we'll be using later in order for you all to kind of see all of the place where we will be putting all of the information that we share in breakouts and things like that. So just wanted to show you what it looks like, and we'll put that link in. So if you could bring this up as early as you can before we start our breakouts later this afternoon, just in case you have any issues, we're able to kind of help you with that. So it looks like this, and then we will be going into more detail about how we're going to use this today, but I just wanted to kind of bring this to your attention. So I will post that in the chat, and if you'd like to bring that up for yourself, that would be great. And then now we will hear from Hillary Conrad from the Office of Child Abuse Prevention.
Hi, good afternoon, everyone. I'm Hillary Conrad with the Office of Child Abuse Prevention, and we are part of the Department of Social Services of California. And I just wanted to open this webinar to speak a little bit about what the Office of Child Abuse Prevention's vision is and how it aligns with the work that Strategies TA will be doing and has been doing. Our vision is to shift public and private partners of child and family service agencies to a prevention mindset. I'm going to tell you a little bit how we plan to achieve this vision and a current initiative that we are partnering with Strategies TA in order to make this happen. Next slide, please. Recently, we released a new strategic plan for 2020 to 2025, and we revised our vision to focus more on integrated systems that support families to provide safe and stable nurturing relationships So a shift from not only child abuse prevention, but also to think about children, family, community, and well-being. We have three main objectives that are our focus of our strategic plan. The first objective is focused on expanding capacity of prevention partners through providing training, technical assistance, and the development of tools such as best practice guides. Our second strategy is focused on uniting partners by linking public and private agencies through collaborative work. And then our third strategic objective is leveraging resources to create a statewide network that promotes sharing among agencies and across counties. Next slide, please. This slide shows our theory of change and our thought process and pathway to achieve this vision. It is centered around connecting partners not only at the local level, but also at the statewide level. Our goal is really supporting one another in these efforts. And when I say one another, I mean not only agencies, but counties, and then as a state as a whole. The network promotes healthy children, families, and communities and prevents child abuse and neglect. So this theory of change just shows how we decided to go about achieving our vision and mission, which is that integration of systems and connecting systems. Next slide, please. How are we going to go about doing this? Well, we created a framework that focuses on creating and building a prevention services continuum at different levels. And as you can see, we have a primary, secondary, and tertiary levels. In the primary level, we are supporting the social determinants of health and addressing community risk factors. So this level of services is focused on the general audience. Anyone would be able to receive the services. So this could be public education, a public awareness campaign, anything that all of us have access to. Then you have the secondary prevention level, which is focused on building protective capacities within families and addressing child and family risk factors and decreasing adverse childhood experiences. So the secondary prevention level is focused on those populations that may already be at risk. For example, pregnant and parenting teens, or single parents, or children or parents with disabilities. Finally, you have the tertiary prevention level, which is focused on intensive services to prevent further child maltreatment or system involvement. These typically are very wraparound services or services that are focused on addressing whatever led to the child maltreatment. Next slide, please. So the initiative that Strategies TA and OCAP are partnering on has to do with prevention planning teams. And what exactly is a prevention planning team? A prevention planning team is a cross-sector team that is focused on developing a primary and or secondary prevention plan that has a shared agenda. So if you look at the slide, we have demonstrated the different service sectors that are working together on this team in order to achieve a community that is improving their social determinants of health and addressing community risk factors, or focusing on family risk factors by building protective capacities. Next slide, please. This slide is to point out how prevention planning is really linked to our strategic objective and goals. As you can see, we're expanding the capacity of prevention networks to provide coordinated services. We're uniting partners around a primary and secondary prevention agenda that maybe before they were operating in silos. And then finally, we're leveraging resources by the members of the team sharing with each other, whether it's funding or how they currently do processes, how they coordinate services, bringing them all together to explain to each other how they can coordinate services more effectively. Next slide, please. And then finally, I just want to kind of highlight what the benefits of cross-sector collaboration are. It's really about broadening your network that already exists and starting that conversation between each other. It's also helping to improve, as I mentioned earlier, the coordination that is happening between the partners that are at the table. And by having that coordination between each other, you can really improve the access of services and also the time in which services are provided to the family or the children. It also shifts the idea of thinking about the back end of services and focusing more on the front end. So you're having a proactive approach. And by doing this, you can release some of the burden that might happen to the workforce that is providing the services. So by doing that, you're increasing the retention rate of employees. And then finally, by focusing on cross-sector collaboration and primary and secondary prevention, you're moving to providing those services in home and preventing children and families from entering systems that they may not need to. Next slide, please. And I just want to end it with saying all this work that we are doing it between Office of Child Abuse Prevention and Strategies TA as a collaborative effort. So we are modeling what we're hoping to see at the local level for all the prevention planning teams. Currently we have 24, and our goal is that we will have all counties participating in prevention planning sometime in the near future. Thank you so much.
There's my mute. Thank you, Hillary. This is Michael again. So I was going to introduce our segment where we start to describe what Strategies Technical Assistance is. And being one of the folks who has been with Strategies prior to this iteration, I'll describe a little bit what our transition has been. Folks may know Strategies from many years back, providing training and consulting to the family strengthening field. In 2016, Strategies became Strategies 2.0, which brought in, Children's Bureau was part of it all along, brought in the CAP Center, as well as the Social Policy Institute of San Diego State, and we built a pretty large system of trainings and regional networking and consulting statewide. In 2019, as many folks know, we worked with the Office of Child Abuse Prevention and the Prevention Cabinet of the Child Welfare Directors Association on the Prevention Summit. And that really focused our technical assistance work. And so since July 1st of this year, that's been our work, is this technical assistance focused on assisting counties to create collaborative child abuse prevention plans. We'll still offer some training and support of those plans, and we'll also offer consulting for folks who aren't in the planning process yet, and we'll describe more of that as we go. But I think first Sarah is going to introduce the team a little more.
Hey everyone. So I have the distinct honor of being able to introduce an amazing team to you today. Some of these faces you might recognize and some of them might be new, but this is the team that's going to be supporting the prevention planning teams, the existing teams, as well as the teams coming in. We have, enhanced our capacity a bit, so we're ready to work with new folks as well. So as you know, you've met Michael and myself. Troy Nichols, who's one of our senior technical assistant specialists. Next slide, please. Lola Cornish, who is supporting the Northern California region and her very cute baby there. Lucy Hernandez, who is also working in the Northern California regions. Sally Price, who is doing data and information for us, which is essential. Next slide, please. Bryn Pascal, who's also our data support. Anvi Din, events coordinator. And lastly, the newest member of our team, which is Rosalind Jung, who's a senior technical assistance specialist as well, working with Central Valley and Southern California. Next slide. Last but not least, we have Lydia Marquez, who some of you might know from the Southern California region. as well as Barb DeGraff, who is in the Sierra region and has a lovely background there. Next slide. All right, so what do we do?
Back to me.
Pass it back to Michael.
Right, so what do we do? Well, we'll start with the next slide, which is our mission and vision. And so having become a new project in a sense, or a newly focused project, we spent some time reflecting on what it is we are here to do and what is the change we want to create in California and in the counties we're supporting. So our mission is that we support cross-sector networks in California centered in equity and inclusion to advance a community-driven commitment to strengthen families. And the vision is focus, and you can kind of hear echoes of the OCAP vision, because we are at the service of the OCAP vision: united communities, strong families, thriving children. And we, as you all who are doing the work in the counties know, your work is building the strength and pulling your communities together to support families and children. And so we'd like to be a support of that happening within your counties and statewide. So next slide. So this is a quick overview of the array of work that we'll be doing with counties, and I'll describe it briefly, and then our team members will go into a little bit more depth. So on the left are the things we're doing with individual counties. And so there are, of those 24 counties, I think 18 we're working with actively to support their collaborative child abuse prevention plans. We also, if a county is not yet doing that work, you can reach out to us or to your OCAP consultant to learn more. And especially for a Child Abuse Prevention Council, if there is support you need before even thinking about taking on a big collaborative project, we can also help you with that. We have on our website, as well as available in hard copy, if you'd like to let us know where to send those, the publication Child Abuse Prevention Council Best Practices, and that is also kind of describes the array of supports we can provide to CAPCs around the state. Our consulting, as it evolves during the next few years, leverages our internal subject matter experts, and also we are connecting with subject matter experts around the state and across the country specific to some of the county needs. And there'll be presenters at our events, but also we can arrange on a limited basis some one-on-one conversation with some of these national and statewide subject matter experts to help focus some of your work. In terms of building that statewide movement, we are going to be supporting learning exchanges, and those will be peer learning opportunities to go deeper with some of the work around planning collaborative child abuse prevention planning. We will have a series of webinars that you'll learn more about, and we are collaborating with the Office of Child Abuse Prevention on regional and state gatherings to pull everyone together. And I think, next slide. And I think I'm handing it off to Lucy.
Oh, thank you, Michael. Well, my name is Lucy Hernandez, as you mentioned, as Michael and Sarah mentioned. We're really excited to come and work with multiple counties, and I wanted to share with you what the journey has been and why are we here today. And I want to start by sharing with you, and I'll go ahead and ask, we can switch to the next slide. I want to share with you a timeline that allows us to better understand how did we come up with a partnership to be able to develop an effective delivery of service for you today. As you know, the statewide county prevention planning actually started back in 2018 when we had the CWDA Prevention Cabinet and OCAP approach strategies in an effort to be able to build a partnership so that we can come together to support our child abuse prevention councils. One of the things that we started was by generating a summit. And so in 2019, we actually launched. In January, we launched our OCAP and CWDA and strategies collectively launched our first prevention summit. This prevention summit was attended by over 20 counties throughout the state. And this was the first time that we had an opportunity to learn where most of these counties were. What were some of their challenges? Where were they currently? Some of the statuses that they had, some of the partnerships or collaborations that they currently had in place, and some of the perhaps members that were missing, key members. This allowed us to be able to start building a plan, a work plan that allowed each county to go back into their counties and actually drive this plan through some of the strategies and objectives that were identified through the summit. After we developed this summit, we knew that we had to continue supporting these counties. And so between 2019 and 2020, our TA specialists and consultants actually worked along with OCAP to deliver key services when it came to supporting them, helping them build some of these partnerships, helping them assess some of the areas that they needed to work in order to develop a stronger framework as a Child Abuse Prevention Council. Our goal was to be able to develop key customized services to help each unique county. And in July of 2020, we actually received a contract by OCAP. And this contract allowed us now to fully support and develop this as our main priority, is to work with each of our counties to be able to sit down and be able to assess where are they from their current work plan, or what do we need to do to be able to help them continue developing a strong prevention planning team. Next slide, please. And so today you see Strategies actually launching this service because we are here to support you. We want to work with you in your county to be able to build a strong, unified team to be able to work on prevention efforts. So to be able to understand what the team's about, the team, first of all, starts with the first, you see it, the circle here, you see that in the graph, we have 3 elements. The first element is to make sure that we have our CAPCs working hand in hand with our child welfare services. It is critical to be able to unify our efforts as a county so that we can work on prevention efforts that will support the macro community. Second, it's important that we understand that we have to have goals. What are those goals? And to be able to build on those goals, we are here to support you. If you're not sure, or if you're not sure how to maybe work with a specific partner or to identify what partner should be at the table, we are here to support you. The third component of our support is to be able to help with cross-sector collaboration networks. We want to help you build an asset map of what are your partnerships looking like today and what can they be. We are here to help you strategize and to be able to build a strong prevention plan for your county. So Strategies is really excited to work with you, and we look forward to continuing to support you. And if we are not currently working with you, we welcome you, as our team is ready to support each of your county members. Thank you. And I'll go ahead and pass that now to Sarah.
Thanks, Lucy. Hi, everyone. So I first want to share a little bit about our core values. And just to say that these weren't thrown together just for the purpose of having core values to talk about, but instead these values were crafted by the team over several months with a lot of intention and a lot of edits. So I'm going to tell you a little bit about each one so you'll have a better idea of sort of the base from with which we're working. So in terms of accountability, we'll create a culture of accountability by owning our own responsibilities, following through on our commitments, and adapting based on feedback and experiences. So much of our work in this pilot year will be about testing and learning because this exact model has not been done before. The next thing we'll talk as of our core values is equity. We hope to support counties and networks to reflect candidly and act on what their local data and communities say about inequities in their service systems. We also want to know how their own roles, policies, and practices contribute to structural injustices. In terms of collaboration, we will support counties to align their efforts towards broad-based collective impact and to connect with peers to develop a transformative statewide prevention movement. With community voice, a very important one, Strategies is supporting counties to engage and respond to the full diversity of the community. We want that to include community voice and choice, and to cultivate consistent leaders and champions for child abuse prevention. As you all know, this cannot be done without the community there. Lastly, we hope and want our services to be strength-based, to inspire and support counties to seek and apply strategies and tools that identify and maximize the strengths of our communities and of our families, who, as we all know, are incredibly resilient. So thank you. I will now introduce, go to the next slide, our poll for today. So in terms of the values that I just spoke about, we'll have a few minutes to say, we hope you to cast your vote on which of the strategies TA values do you and or your organization most connect with.
All right, everybody, so go ahead and make your selections, and we'll give you about 20 more seconds to do that. And we'll close this in 5, 4, 3, 2, and 1. So we're closing the poll now.
Wonderful.
Let's share those results.
So it looks like collaboration is the value that is expressed here most, which is amazing. Yes, as I mentioned, we know that we cannot do this together without each other. Secondly, following equity, strength-based approaches, community voice, and lastly, accountability. Thank you all for participating, and I think it's interesting to see where others are in the state in terms of their values and work. All right, and I will now pass it off to Lola.
Hi there, I'm Lola Cornish. I'm one of the Strategies TA consultants, and I'm here to explain to you a little bit about what Strategies TA support looks like. Can we have the next slide? So we are working very diligently with a TA team of professionals that have skills and expertise and knowledge.
Lola, lost your sound.
You lost her sound, Lola.
Yeah, I think she's trying to connect.
The Zoom world.
Maybe we can swing back to this slide, and if Lola doesn't have her sound by then, one of us will pick up.
Yes. So maybe we can go into the learning exchanges. Oh, back one, yeah. Back to learning exchanges, please. Yes. And we'll have Troy, who will go ahead and tell us all about the new learning exchanges.
Awesome. Can you hear me? You can hear me okay?
Yes.
Yes.
Awesome.
Okay.
Sorry about that. So learning exchanges, it's a opportunity for us to provide another aspect of collaboration. What I have on the screen here are our purposes and the functions that we're looking to accomplish. Before I get started, I have to give a huge shout out to Judy Sherman, who helped develop these plans. I'm just the face man, and I'll be doing the speaking about it, but Judy's mindset around this has helped me to develop a cogent plan. So I really want to express appreciating that, as well as how we're going to shift this. You know, the learning communities that we had prior to this had a focus, and I'm going to talk a little bit about this, but our learning exchanges are going to take us in a new direction. It's going to be member driven. And our plan is to really accomplish these 4 goals: developing relationships, learning together, carrying out tasks and participating in projects, and creating new knowledge. And that knowledge base is going to come from the prevention planning teams. Judy Sherman named them OCAP's Prevention Planning Team Trailblazers. So that's what I'm going to call the folks from San Diego. You're the OCAP Prevention Planning Team Trailblazers, and we're going to use those ideas to foster the work that we do. So one thing before I move on to the next slide is no, can we move to the next slide? Because one thing before I'm done my presentation is I just want to show you some of the differences, because for those of you who have been a part of us since the beginning of time, I'm probably the oldest, not oldest by age, oldest by time frames with regards to having been here. And I see many faces who were part of our learning communities. And I just want to quickly highlight what the differences will be. Our learning exchanges, it'll be a targeted group. We're going to target outreach, cohort kind of mentality, whereas we just cast a wide net before for participants to bring in for information sharing in our learning communities. It's going to be member driven as opposed to facilitator driven. What we will do, and being that it'll be my and Judy's baby, what we will do is give guidance. We will give behind the scenes support, on stage support, but the ideas, the concepts, the work, the outputs will be member driven. Participants are now members. So you're not just participating, you're a member. There's some ownership to the goals, the outcomes, and the work. Whereas participants were loosely connected before. I think we made some strong connections, but overall, it was more of coming, gathering, sharing information, and going back to your respective silos. And we want to create pathways as opposed to silos. And finally, the topics that emerge from the prevention team will be from the prevention team's focus. Remember that Trailblazer group? Well, all of you now will be dubbed Trailblazers, because the ideas on how we produce this work, how we come to outputs, is going to look different than just determining it through interest surveys. It's going to be really addressing the needs through needs assessments and various other avenues. But if I could express anything, member-driven versus participant-driven. That's all I have. Any
Okay.
questions?
So we can go to webinars and then. So as you know, when we were Strategies 2.0, we were known for our webinars. Well, get ready, because we are going to be really known for our webinars now. We will be producing some really high quality online events that really explore collaboration, child abuse prevention strategies and initiatives that have been successful, not just here in the state of California, but nationwide. We really want to be able to bring timely and relevant information that includes the latest research, the latest experts from the field. So we will continue to do that. Some things we have in our wheelhouse are looking at asset mapping, human trafficking, and also collaborative networks, and how some collaborative teams have been able to do this work together successfully. So we're really excited to bring those things to you. And now what we'll do is we will go ahead and swing to statewide and regional gatherings, which we will hear about now.
Thank you, Lydia. I'm Barb DeGraff. Many of you know me. I was the Learning Community Facilitator for the Sierra region in the Strategies 2.0. And I think, Troy, I may actually be the oldest on every level because I also was a part of the original strategies as the Strengthening Family State Lead. So I'm thrilled to continue to work with the Sierra region. But we are also really excited. Strategies TA is going to partner with OCAP, and we're going to be offering annual, statewide, and regional gatherings for counties involved in prevention planning. These gatherings are going to be an opportunity for you all to network. You can share information on new developments in the prevention field, and we can bring in folks as well to these gatherings. We're hoping that this first statewide meeting will be held in the spring of 2021, likely on a virtual platform. The intended audience for that first statewide meeting will be members of the prevention planning teams, as well as your local partners. The information is going to include updates from strategies, updates from OCAP, Child Welfare Directors Association, as well as latest developments in the field. And we're going to devote time to cross-sector, cross-county networking and resource sharing, because that seems to be something that folks really appreciate, having that time to learn from each other. There will also be 5 regional gatherings every year, one for each OCAP-defined region. The first round also planned for the spring of 2021, and the audience there is primarily prevention planning team members and their partners, but also folks from neighboring counties that are interested in joining us in this work. We will invite you as well. The regional gatherings will have networking opportunities and resource sharing, as well as statewide updates, and then additional topics that are of specific interest to each region, because we know that California has such diversity in its regions. Thank you. I don't know if we're going to try to go back to Lola now, or?
Yeah, let's try to go back to consulting.
Okay.
Hi, everyone. So sorry for the technical issues, but I'm sure you all can relate dealing with the virtual world right now. So I just want to share a little bit about our technical assistance team of professionals. You may have worked with many of them through Strategies TA. So in our new iteration, we really hope to support the child abuse prevention councils in any development they may need, as well as incorporating child abuse prevention councils and child welfare into the prevention planning networks. We hope to support these teams with developing their plans. And I should mention that the plans, we have 3 years in our current contract to support networks in doing their plans. A big part of that is to create sustainability and to create the foundations for your networks to thrive. So there is a big emphasis on the prevention plan as a whole, so we can help your network thrive and move forward when we're not available. So we'll also look at providing some customized TA that meets the needs of counties. And the ways we'll do that is either through process consulting, product development, facilitation, leadership coaching, and capacity building. And obviously these can be done, multiples can be done at the same time. Next slide, please. There are kind of 2 paths to making this happen. So the first would be supporting county networks in developing their comprehensive child abuse prevention plans. And also we can offer time-limited technical assistance to CAPCs and counties to address any specific issues they might have or be challenged with. And I think that is it.
All right, so let's talk about our prevention counties. We're going to highlight 2 gracious counties who will be sharing their experiences with Strategies technical assistance. Currently, we are supporting 24 counties. Our goal is, as Hillary mentioned earlier, is to have all 58 counties on board with child abuse prevention planning. Next slide. So I wanted just to highlight the consultants by their county. So as you can see, we have consultants who are all over. So here are our consultants. We have Michael Williams and Judy Sherman, who are supporting Sacramento, Santa Clara, and Stanislaus counties. Next slide, please. And then myself supporting Orange, Riverside, Santa Barbara, San Luis Obispo, and Ventura, as well as Barb DeGraff, who is currently supporting Calaveras and Sierra. Sarah Lacroix is also, again, with our newest addition. Rosalind Dong is supporting Kern, Tulare, Fresno, and San Diego counties. Next slide, please. We have Lola supporting Colusa, Napa, Nevada, Placer, Yuba. Lucy, who is supporting Humboldt, Mendocino, and Lake counties. Troy, who is supporting Contra Costa, El Dorado, Marin, Santa Cruz, and San Francisco counties. Okay, next slide, please. And so one of our counties we'll be highlighting will be Santa Clara. So we'll have Michael introduce Santa Clara County.
Great, thank you. Yes, I've had the pleasure of supporting Santa Clara County since the summit, and I know we're wanting to be concise and move forward, so I will just introduce, well, actually I'll say a couple things that really excite me about working with Santa Clara. One is a deep commitment from child welfare and the CAPC to partner on this, and child welfare has really been a co-lead, and that's been exciting to see. And then a deep commitment to really elevating community voice. And you'll see in this presentation a real systematic effort to do that. So with that, I will pass it on to Jennifer Puthoff, who has been our partner with the County Department of Child and Family Services.
Thanks, Michael, and we are certainly appreciative of your support. We couldn't have done this without you. So good afternoon, my name is Jennifer Puthoff, and I'm the project manager for the Prevention Bureau at the Santa Clara County Department of Family and Children's Services. Yes, that is right, the Prevention Bureau. We're actually one of very few county child welfare agencies to have a dedicated bureau focused on primary, secondary, and tertiary prevention. And our journey for this work actually launched in early 2016 as the department was one of 7 counties participating in the California Wellbeing Project. The project provided participating counties with the flexibility of using federal funding to invest in proven and innovative approaches that better ensure the safety of children and the success of families. And as we started this project, we began having deeper conversations with our communities who are at greater risk of involvement with child welfare. And as a result of these community discussions, the overwhelming response was that more needed to be done before DFCS knocked on the door. So fast forward 2 years later, in partnership with our lovely local CAPC, we invited 60 community agencies and stakeholders to a very early morning meeting to discuss, map, and share what the current child abuse and neglect prevention efforts look like across the county. The meeting was really an opportunity to see if there was any synergy to support an ongoing collaboration uniquely focused on child abuse and neglect prevention. And to no surprise, our county key stakeholders agreed that a robust county plan was needed and warranted. And timing couldn't have been better because in January 2019, the Prevention Cabinet of the County Welfare Directors Association of California, the California Office of Child Abuse Prevention, or OCAP, and Strategies TA hosted the first ever statewide prevention summit in San Diego. That summit was really a springboard to help counties convene a cross-sector team of leaders prepared to deepen collaboration and commitment to a shared strategy and goals towards child abuse prevention and family well-being. And as one of the 22 counties attending, we pulled together a team of 10 leaders in the county who had a deep interest in the prevention of child abuse and neglect. And it included really a cross-sector of both CBOs, educational institutions, First Five, and other government entities. During the summit, we learned about promising practices from across the state, including San Francisco's Safe and Sound Child Abuse Prevention Center and the Magnolia Community Center in LA. All of the prevention promising practices included a strength-based approach to working with families, included parents as core resources, focusing on high-need populations through a cultural lens, using data to drive decision-making, evidence-based or evidence-informed programming, and utilizing a cross-sector approach. This really helped reaffirm what many of us around the table already knew was happening in our respective systems, but we weren't doing this in collaboration together. So at the summit, we also learned about several frameworks, and a lot of the frameworks we're using today in terms of the prevention theories and opportunities and activities for success and effective community-based prevention coalitions. With the help of Strategies TA, our local team of 10 started draft language around what our prevention plan could look like. And after the summit in San Diego, this dedicated team developed into a local prevention cabinet. We're not very good at coming up with these really good names, so we just start borrowing them from other categories. But our prevention cabinet unanimously came together and decided that a countywide prevention plan must include the voices of the community. And community stakeholders need to be involved in the planning and the development and decisive action planning for this work. So the cabinet team in partnership with Strategies then helped us launch and develop the first of our community guided prevention summit series in Santa Clara County, with our first summit in person in November 2019. And then we just hosted a virtual summit this past September. Both summits had over 100 people in attendance and included former foster youth, parents, faith-based leaders, agencies, educators, law enforcement, and local nonprofits. And before I share more about the summits, we'll have an opportunity to go in more detail. I'm going to ask that Rocio Bundes Rodriguez, who's our Program Manager 3 for our Prevention Bureau, to share a little bit more work about our ad hoc committee with our local CAPC.
Thank you. And first of all, I just wanted to add that one of the exciting things about Santa Clara County is that they have demonstrated their commitment to prevention to the extent that they have developed a prevention bureau. So that is super exciting, and there's dedicated resources for us to do the work that we're doing. So in terms of the ad hoc, to get CAPC even more engaged and involved in owning the final strategic plan, what we did is we developed a subcommittee of the Child Abuse Prevention Council, and that focuses specifically on prevention and specifically to own the final product, the strategic plan, and to figure out how to support it. We have just had a few meetings and already there is a tremendous amount of support. One of the things we decided was we would create a position paper to speak about the importance of child abuse prevention and basically everything that you just shared about the importance of our work, and to lift up the data that comes out of these forums and highlight that in the position paper. And then what we would do is present that to decision makers. So we would present that to the board, to different subcommittees of the board, to leadership within the county, in hopes to gain support for continuance of the Prevention Bureau, but also potential funding for new strategies. So super exciting work. We have another summit to come after the new year to finalize the collection of all of this data. We collected a lot of data from the community. And so now we want to start putting it into a plan and making sense out of it. So a lot of work to come, very exciting stuff.
You can go to the next slide, please. So with the community needs in mind, our leadership team or prevention cabinet started to develop the planning for the community guided sessions or these summits to happen locally. With the first of our summits in 2019, focusing on sharing and reviewing data. So we utilized a gallery walk approach. We provided roughly 20 sets of data that included everything from housing, food insecurity, child welfare, juvenile justice, education, and much more. And during the November summit, attendees were asked to think about what the current data says about our county needs, to consider what data was missing and who else should be involved in the conversation to identify solutions. Some of the attendees were so moved by the event that they even volunteered to be a part of our planning efforts, which is lovely. And by February 2020, our prevention cabinet of 10 grew to about 15, including our ombudsman's and mediation office. The staff from the Ombudsman's office helped our small planning team or prevention cabinet categorize the feedback from the community summit into larger need categories. And in September, we hosted our online summit. And so reaching out to those who attended the year prior, we shared their feedback to make sure they knew that we valued their attendance and their thoughts. And then we asked them to prioritize the needs identified and began developing action plans as to what it would take to fully meet those needs. Small breakout discussions were happening via Zoom, and those helped go into deeper dive issues and root causes of some of those data that we'd shared and then deeper needs. For example, community members also shared that the role of child welfare is further perpetuating inequity and structural racism that exist in our community. And so all of that feedback from those sessions were recorded by our moderators for the small groups. And now we're in the process of reviewing and compiling this information and plan to host another summit, as Rocio mentioned, in 2021, where we'll start reflecting on what was shared and then really begin identifying strategies in effort to develop a more robust action plan to address those needs. You can go to the next slide. So with the support of strategies, we've really been able to better identify a roadmap as to what it would take an effort for our county to be successful in launching our county-wide prevention plan. The theory of change provided here has helped our prevention cabinet begin to narrow our focus and effort to bring about the desired change and impact that we're actually looking for. Strategies TA has really assisted us in the development of agendas for convenings, providing backbone support and conversation starter ideas for our community summits. They've even helped with facilitation of our breakout groups for our summit and aided in our transition of the prevention cabinet to a more formal committee under CAPC for that ad hoc group. Additionally, Strategies TA has really been able to provide resources from across the state. For me, this has been incredibly helpful to be able to hear what other counties are exploring, really harvesting their knowledge and understanding, as well as understanding what their challenges and successes are. That's a really helpful tool for all of us. So we have more work to do, and I'm really grateful to the team at Strategies for their continued support. And Michael, we couldn't have done it without you. So we're looking forward to 2021 with you. Thank you.
Same here. Very exciting. It's wonderful working with you all. I'm going to pass it off to my colleague, Lucy Hernandez, who will introduce Humboldt County.
Great. Thank you, Michael. Great. So we also have an opportunity to share some of the work that's being done in our far northern counties here in California. And it is great to be able to see the diversity in the work that's being done, but all focusing and aligning efforts to ensure that we can become a strong prevention planning team. I want to introduce you to one of our counties that's been specifically working with strategies since last year. I just currently started working with Humboldt, and it's been a great opportunity to be able to learn about the different networks that they currently have in place. Cindy Sutcliffe, who is the chair for the Humboldt County Child Abuse Coordinating Council, has been phenomenal in working together and bringing all partners together from First Five, Child Welfare, FRCs, nonprofit organizations, and many others to be able to really be focused on developing this prevention plan. One of the unique things that we have been able to do is through the work and strategies, I've had the opportunity to take a look at the prevention plan outline that has been developed and really reinforce the need to be able to bring some additional partners that are not at the table. Cindy has been phenomenal in being able to bring team members and partners to the table, and I would like for her to share with you the story of Humboldt County's journey. Cindy?
Thank you, Lucy. Thank you very much. Good afternoon. My name is Cindy Sutcliffe, and I am the current chair of the Humboldt County Child Abuse Prevention Coordinating Council, which is a mouthful, so I'm just going to refer to it as CAPC for the remainder of the presentation. I do want to state that, Humboldt CAPC, we put together a team. We went to the January 2019 Prevention Summit. We took with us 2 plans. I didn't actually go, but I'm speaking on behalf of CAPC. The first one was Together Towards Change, which was a plan developed initiated by CAPC. We brought together a prevention planning team, which very much mirrored what OCAP's definition of a team should be in an earlier slide, with all of those 24, I think they had listed partners, and they created a plan which we named Together Towards Change. It was a large plan. It covered everything, soup to nuts, on what we needed to prevent child abuse. They also took with them First Five's strategic ACEs plan with them. And off they went to the summit in January. They worked hard on what they had, but realized that they needed to be working towards creating our own prevention plan, not trying to sort of meld these all together. So moving on, they came back to the county, and Michael Williams, Strategies 2.0, thank you so much, Michael, worked with our county tirelessly and facilitated numerous meetings during 2019 to help us create a prevention plan. We were able to get some initial work done. We got a CAPC vision, we got the data review, and we had a lot of strategy sessions around ideas of what should be in the plan. However, for a lot of reasons, I think the primary one being that we did not have consistency in attendees at these meetings. We had consistency with regards to the agencies present, but not attendees. And so we'd take a little step forward and 2 steps back, rehashing. Anyway, by about November of 2019, everybody was getting a little bit tired. We were kind of done. So could I have the next slide, please? Anyway, we took a break, and CAPC decided to take the lead in the creation of a primary prevention plan. We decided to just break off a piece of this primary, secondary, tertiary model and just focus on primary prevention. We created a team which included Child Welfare Services, First Five, Changing Tides, the Humboldt Network of Family Resource Centers, the California Center for Rural Policy, which is housed at Humboldt State University, and then of course us, CAPC. We had our first and actually last in-person meeting on March 9th, and then of course shelter in place went into effect, and all of our subsequent meetings have been via Zoom. We haven't entered into a memorandum of understanding. These groups that we have at the table have worked together for years and are pretty much, well, not pretty much, everybody's very committed towards creating this primary prevention plan. We don't have any minutes from our meetings. We just simply work on refining the plan, which is in sort of a grant application format because we're gonna need money to make this thing work. Over the summer, we were able to add Lucy Hernandez from Strategies 2.0 to our team. Thank you so much, Lucy. I reached out to Strategies from our 2019 experience and said, I think we're going to need help. We're not sure what it's going to be, but could you help us? And sure enough, they did. And then we also added, and Lucy was very good at reminding us that we needed to have cultural diversity on the team itself, as well as needing a culturally competent and respectful voice in part of the plan, which you'll see in just a minute, which will result in messaging to different communities. So we invited and they accepted both Soledad Torres from Paso y Paso and Dr. Virgil Moorhead from Two Feathers Native American Family Services. Could you go to the next slide, please? And we selected 2 of the 5 protective factors. We decided to narrow our scope. Again, we want to be able to have a plan that's we can implement, that we can actually do. So we decided that it would be important to both increase social connections within the micro communities throughout Humboldt County, and then also to increase the knowledge of parenting and child development. And so these 2 became our goals for our primary prevention plan. Next slide, please. The plan's got 5 objectives. I'm not going to read them out, but we are using the University of Oregon's 90 by 30 plan, which they developed for Lane County, Oregon, sort of as a guide. We're going to be utilizing tools that they developed through their assessment process. For their assessment process, we're going to be utilizing some of their strategies. And I'm really delighted to say that I finally got in touch with somebody from 90 by 30. I'll be talking to them on Friday afternoon. Dr. Jeffrey Todal from the University of Oregon, and we're hoping that that'll be moving us forward on our next step, because the circles of inquiry, we definitely need 90 by 30's help with. And so we're excited about that. Could I have the next slide, please? What we are doing right now is working on objective 4, which was to enhance CAPC's website. We are adding a page called Children and Family Supports, and we're going to be listing website links to all kinds of primary prevention services throughout Humboldt County on this website. We're working on refining the plan for the grant, and then looking for money to be able to implement the other 4 objectives that we have for our plan. And that's basically it.
Thank you so much, Cindy. Thank you for all your leadership on behalf of Humboldt County. And I'll pass it on to Sarah.
All right, everyone. So I don't know about you, but this is generally my favorite part of webinars, where we get to break out and meet other people, especially in this statewide meeting today.
Good afternoon, everyone. My name is Franny Desai. I work for the Office of Child Abuse Prevention. I'm an analyst. I'm the OCAP consultant for the Southern California counties. And so I just wanted to give everybody a little bit of information about our recently launched Prevention Planning Trailblazers portal. Many of our established prevention planning teams may have already received a couple of emails from me. One email kind of giving a tips and guide sheet on how to use the portal, and a second email directly from SharePoint about, it's an invitation actually, on how to access the portal. Only prevention planning team members that are established have access to this, basically a very rich way of sharing resources, collaborating on documents, and essentially communicating with other counties across the state. Next slide, please. So some of the things that you may find on this portal is news and announcements that we are sharing across the state, such as this event today. Quick links, which includes resources and information about prevention planning. A document library, so these are shared documents, so you might find checklists and other resources to kind of help the team move forward with prevention planning process. You'll find our OCAP consultant contact information, so if you need to reach out to us for any information or assistance, please feel free to do so using that contact information site. And then we also have county-specific pages, and I'll discuss a little bit more of that on the next slide. Okay, so our county-specific pages. So each of our prevention planning teams will have their own county-specific page. This page allows counties to kind of share information, share documents It's a SharePoint site, so that means that every member of the team will have access to that document and can upload and input information, similar to the Google Docs document that we were just working on together. Next slide, please. So as a side note, for the county prevention pages, you will only be able to see information that is on your page. You will not be able to see information that is on everyone else's page unless it's shared broadly under all documents. In regards to our discussion board, our discussion board is an avenue in which our county prevention planning teams can communicate with each other. This is new. We don't necessarily always have sites in which you can ask questions to us directly, ask questions of your peers across county teams, things like that. So we're hoping that everyone would be able to utilize this discussion board. And we'll keep track of the questions and things like that that are on this site. Next slide, please. And so if you need any assistance with the portal, I'd be happy to help. You can always contact your OCAP consultant. However, there will be an invitation, and within the invitation will be my contact information. So please feel free to reach out to me. I know several of you have already reached out to me for assistance, and I'll be happy to help. And that's it from me. Thank you.
All right. So just a quick note on next steps after this. After the webinar, you will be sent an email with the SurveyMonkey evaluation link, and you will also receive more information about Strategies TA and how to get your county involved. The webinar recording will be available on our YouTube channel, which is Strategies TA, so you can look up there. And please do subscribe to our YouTube channel. We think that there will be a lot of exciting things to share from the work we're doing. I'll also note that the SurveyMonkey will have some questions about where you want to go deeper with learning. And as Troy said, we want to follow your lead in what will be most useful in learning and sharing with peers. Not only in our learning exchanges, but also for our webinars. If you have ideas for webinar presenters, you can contact us as well. And in our regional and statewide meetings. So please watch for that, and I hope you can take a couple minutes to answer that survey. And I think next slide. I think that is what we got to say. We just appreciate everyone's time, everyone's interest. We're excited to be part of this work with counties and to be building this movement together. And definitely reach out to us. There's our emails. If you don't know if you're Northern or Southern California, you can email both me and Sarah and we'll figure it out. But I just want to thank you all and to thank the team, especially Lydia and Anvi, who were kind of the driving force behind the webinar. And I don't know if anyone else has any closing. Oh, and Sally's put up our website. Definitely look up strategiesca.org. We have some information resources as well as more information on the on our program.
Just wanted to make a note that this webinar will be featured on our Strategies TA YouTube channel. So please follow us on YouTube so that you can see all of the webinar and online offerings that we have available.
One more thing, as a strategies team, we just are looking forward to working with you. And just to share that today we highlighted some of our counties that we're working with that have active planning plans in place. But if your county was not identified and you are working with us, we did not indicate all our outreach counties. So just let you know, we do have multiple counties and we know we're working with you. And we look forward to working with you in a level where we can put you in a place to support you with your prevention planning efforts. So thank you to all our outreach counties that are also participating today.
I'll close this out. Thanks, guys. I'll close this out by just thanking all of you for being here, for spending your afternoon time with us. And we'd like to hear from you as we close out today. So in the chat, if you can please share one thing you learned today or one thing you might want to see more of in a future webinar. And thank you very much.